sejahtera diucapkan hadirat yang dimuliakan. Saya Dr. Nur Faiza binti Muhammad Tauhid merupakan moderator untuk CME kita pada petang ini. Untuk hari ini CME kita adalah bertajuk Are You Okay Doc? Ya. CME ini dibawakan oleh Kerajaan Negeri Selangor melalui satu inisiatif iaitu program yang kita kenali sebagai SEHAT, iaitu Selangor Mental Health. Sebenarnya program ini telah dimulakan sejak selepas COVID-19 baru-baru ini, memandangkan isu kesihatan mental merupakan salah satu threat utama ya, selain daripada isu-isu kesihatan dan isu kewangan. Memandangkan isu kesihatan mental merupakan salah satu aspek yang amat perlu diberi perhatian. Oleh itu, Kerajaan Negeri Selangor dengan kerjasama daripada International Islamic University Malaysia dan juga dengan kerjasama daripada Malaysian Psychiatrist Association bersama-sama berusaha untuk menangani dan juga memberi kesedaran dan intervensi kesihatan mental kepada penduduk Selangor secara khusus dan juga seluruh warga Malaysia secara amnya. Dan untuk petang ini, CME ini adalah dibawakan khas kepada para primary care doctors supaya mereka dapat sama-sama mengesan dan juga untuk mengesan isu-isu kesihatan mental pada peringkat awal dan juga dapat memberikan intervensi yang sepatutnya. Untuk hari ini, tajuk CME kita ialah Are You Okay Doc? Tajuk ini dipilih memandangkan doktor juga tidak terlepas daripada menghadapi cabaran terhadap kesihatan mental para doktor sendiri. Doktor juga manusia biasa kan, kita juga tidak terlepas daripada isu-isu kesihatan, termasuklah isu-isu kesihatan mental. Terdapat banyak isu kesihatan mental yang dialami oleh para doktor, selain daripada isu yang disebabkan kewangan, perhubungan, isu dengan rakan sekerja dan juga pelbagai lagi cabaran-cabaran kehidupan kita yang boleh menjadi musuh utama kepada kesihatan mental para doktor. Untuk CME pada hari ini, kita amat berbesar hati kerana ada bersama kita Dr. Rostam bin Muhammad Zain, seorang konsultan licensed psychiatrist yang bertugas di Hospital Sultanah Bahia. Dr. Rostam merupakan graduan Universiti Kebangsaan Malaysia dan juga graduan sarjana Master in Psychiatry dari USM pada 2018. Kami ucapkan selamat datang kepada Dr. Rostam. Untuk tidak melengahkan masa, saya menjemput Dr. Rostam untuk mengupas serba sedikit tentang isu Are You Okay Doc? Silakan Dr. Rostam.
Okey, baik. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan selamat hari kepada doktor-doktor sekalian. Terima kasih kepada Dr. Nur Faiza atas pengenalan itu tadi. Saya Dr. Ahmad Rostam bin Mazin, Consultation Liaison Psychiatrist. Sekarang ni bertugas di Hospital Sultanah Bahia Serta, tetapi bersiaran daripada Kuala Terengganu because I'm currently outstation. So doktor pun kena outstation juga kan, once in a while. So that's quite common for us nowadays, yeah. Sorry.
Saya rasa sebelum doktor pergi lebih lanjut, sebab saya ada dapat juga beberapa pertanyaan tentang apa itu licensed psychiatrist. Kita biasa dengar pasal substance abuse ke.
Tambah sikit lah. Tambah.
Cuba terangkan sikit pasal licensed psychiatrist ni.
Okey, liaison psychiatrist ni adalah salah satu subkepakaran yang ada dalam psikiatri. Kita ada, saya rasa kalau tak salah kira 6 kepakaran dalam psikiatri, dan consultation liaison psychiatrist adalah salah satu daripadanya lah. Dan consultation liaison psychiatrist ni adalah salah satu subkepakaran yang muda lah di Malaysia. Even kami punya the most senior consultation liaison psychiatrist pun tak pension lagi. Sedangkan semua sub psychiatri yang lain sebenarnya ramai sini-sini dah pension apa. Di Malaysia, Dr. Azizul is the most senior one. Currently yang ada lah, actually yang awal seorang dah ada pension, baru je pension tapi dia tak pension umur 60, dia pension awal 56. Jadi dekat Malaysia kita ada lebih kurang 10 orang yang ada di Malaysia. Tak semua negeri ada, majoriti daripada consultation liaison psychiatrist ada di Lembah Kelang, adalah seorang di Sarawak, ada seorang di Kedah yang mengkomi Pening, Perlis dan Kedah, ada 2 di Perak, dan yalah, itu je lah yang ada, Kuantan seorang lagi. Yang lain-lain tu belum ada lagi. Jadi mungkin kalau tak pernah jumpa kami, sebab kami buat masa ni masih rare, tetapi spesies kami akan meningkat dari masa ke semasa lah. Benda yang kami buat mainly adalah what we call as kami melihat pesakit-pesakit non-psychiatry yang mempunyai psychiatric manifestation. So sebagai contoh, majoriti dari kami memang wajib kami berada di hospital-hospital berpakar penuh, sebab pesakit-pesakit kami akan datang daripada referral daripada ada disiplin dalam hospital tersebut lah. Kami tak tengok general psychiatry, walaupun boleh tengok ke general psychiatry, tetapi our main business will be inpatient referral. Inpatient referral, contoh stroke ke, CKD ke, apa-apa je lah. Rheumatologi ke, hematologi ke, surgery ke, ortho ke, apa-apa bidang sekalipun dia akan refer kepada liaison psychiatrist lah. If you all familiar dengan sistem dalam referral psychiatry dekat dalam hospital, most of the hospital korang akan rujuk kepada doktor di bidang liaison psychiatry, tapi walaupun mereka tak ada consultation liaison psychiatry, tapi memang ada servis tu di mana-mana. Okay, saya kembali kepada topik pada hari ini. Ladies and gentlemen, first and foremost, when we're talking about are you okay, right? Are you okay is actually a proper movement dalam konteks kesihatan mental di dunia, yang mana are you okay, if you type this out dekat internet, you will find out that it's actually a proper movement in which they are trying to advocate people untuk bertanya orang-orang di sekeliling mereka every single day about are you okay or not. So as simple as dia punya ayat dah are you okay, which is actually a very powerful statement, very powerful question to someone in need. Sebab dalam konteks kesihatan mental ni kan, dia bukan sesuatu yang mudah untuk orang bercerita kan, especially we as the professionals. We try not to tell people that we are weak. We are trying to tell people that we are strong. And at the same time, we are trying our best to make sure that we can function as good as possible. Sebagaimana yang Dr. Faizal disebut tadi, most of us, kita ada banyak responsibilities, not only in our workplace, we have responsibilities at home, we have something to cater outside of our working space dan sebagainya. Kita perlukan macam-macam perkara dan kehidupan kita, which is actually we need a lot of resilience, a lot of mental health strength in terms of facing all these adversities. And every single one of us dalam Zoom hari ni can tell to me or to everyone that they have their own difficulties and struggles in their life, which is it's actually normal, Every single one of us memang tak ada pun hidup dalam keadaan yang tenang all the time, always in a smooth pathway kan, no challenges at all, regardless of where you are, which specialty that you are taking now, or what nature of job that you are doing right now. Sama ada you are dekat private ke, dekat government ke, sama saja kan, same thing. Of course, people will be trying to find out why which one is better, government better ke, private better ke, department ini lebih baik ke, ataupun hospital ini lebih baik dan sebagainya. But at the end of the day, the one who need to face all these adversities and problems and challenges will be we who choose it. Okay, when we are talking about mental health, guys, first and foremost, we must know what is the definition of mental health first. So, kalau kita tak tahu apakah definisi mental health, macam mana kita nak membantu diri kita dan mengenal pasti bahawa diri kita ni okey atau tidak. Before I go into the definition, first we must you all mesti dah tahu dah korang punya baseline kat mana. How good you are, how bad you are, what is your weaknesses, what are your strengths and everything. Korang tahu tentang diri korang, and I'm very sure that when someone asks you who you are, try to explain to yourself to someone else, you can explain yourself very well. Tapi jika sekiranya if you are not able to explain yourself very well, that's one of the first components of mental health. Because there are 4 components of mental health when we are talking about the good mental health. The first component of mental health is our ability to be able to recognize and use our strength and weaknesses. Kita ada kemampuan dan pengetahuan berkaitan tentang kekuatan dan kelemahan diri kita. Kalau orang tanya kita apa kekuatan kita, mungkin kita takkan jawab secara terus terang, tetapi kita tahu kat mana kuat kita, kat mana lemah kita. That is actually the first component of mental health. If you are still not able to tell people or to tell yourself what is your strength and your weaknesses, means that you are not actually kenal diri you dengan baik. Okay, so itu adalah satu komponen daripada kesihatan mental, di mana kita kenal diri kita. That is very important. Kalau korang tak kenal diri korang tanyalah orang lain. Tanyakan kawan, tanya orang yang tersayang, tanya pasangan, tanya suami, tanya isteri, tanya mak ayah dan sebagainya. Tanya dia orang siapa kita. Sebab that is actually the first component of mental health. Some people will not be able to recognize their own strength and weaknesses, which is actually one of the risk factor of developing a mental health issues. Okay, because when you don't know what is your strength, How can you work on things that you are doing in your life? You don't know how to approach things. You don't know how to make a decision. You don't know how to plan. You don't know how to cope because you don't know who you are. And that is a very important component altogether, right? The second component of mental health is actually our ability to cope with the normal stresses of life. As I already mentioned, initially, we have lots of problems in our life, lots of challenges, lots of adversity, lots of issues, lots of stress that can cause us to be in pain psychologically, right? So our ability to handle all these normal stresses in our life, daily life, means the normal stresses can be anything, right? It can be about money, it can be about our cars, it can be about our house, it can be about our relationship, it can be about work, about our boss, it's about our business or our study, whatever it is actually something that considered as a normal stresses in life, which is really part of our life as a doctor. If we are not able to manage all these normal stresses in life, kita kebadan-kebadan besarnya berhadapan dengan isu kesihatan mental. Sebab isu kesihatan mental ni guys, is not mental illness. Isu kesihatan mental and mental illness is actually two different things altogether. Mental disorder is a appropriate diagnosis that can be made based on symptoms, clusters of symptoms. But mental health issues can be anything under the sun. It can be as simple as feeling helpless and hopeless. It can be as simple as feeling overwhelmed, burnout, stress dan sebagainya. That are all considered as mental health issues. So the ability to cope is one of the components of mental health. Third component of mental health is actually our ability to work productively and fruitfully. Maksudnya kita ni berfungsi lah dalam jabatan kita ni berfungsi lah dalam organisasi kita ni berfungsi lah dalam ruang lingkup tugasan kita kan. Orang nampak kita sebagai seorang yang berhasil. Orang nampak kita ni sebagai seorang yang boleh diharap dan orang nampak bahawa kita ni boleh menyelesaikan tugasan. Kalau orang duk komplain pasal kita, something is not right. Kalau kita mahu perangai kita daripada dulu macam tu, that is not mental health issue. That is actually pemalas. Tapi most of us, by the time you are a doctor, I can be very sure that most of you is a very competitive, very objective and orang-orang yang sangat-sangat produktif kan. Betul. So dalam konteks ini sebenarnya kita semua ni adalah orang-orang yang functional baseline-nya. That's the reason why we become who you are right now. But there will be time in which we are not able to work productively and fruitfully, and obviously when this time comes, guys, that is actually a sign or warning sign to say that your mental health is actually in jeopardy. So bila kita dalam konteks kesihatan mental ni, kita kena lihat tiga komponen ni. Dan last component is our ability to contribute to our community. For example, for today, right? Every one of you kan, you spend a bit of time, 1 jam bersama-sama dengan saya pada petang ini untuk mendengar tentang bagaimana membantu diri sendiri. Which is the reason why you want to find this, because you want to help others. Kan kita nak membantu orang lain, kita nak membantu kawan kita, rakan sekerja kita, mungkin klien kita dan sebagainya, pesakit kita dan sebagainya. That's the reason why you are here. And the contribution to your community is actually part of the mental health. So the 4 components of mental health, nombor 1 adalah kenal diri, nombor 2 adalah able to cope, nombor 3 adalah working productively, nombor 4 adalah contribution to the community. Is actually the major cog in terms of whether we are okay or not okay. Okay, if let's say one of the components is not okay, means something is not right. We need to check back. So how to check back? Okay, that is actually mental health, guys. Tapi macam mana? Sometimes maybe untuk mudah, maybe some of you asking me, how do I know whether I'm okay in terms of mental health or I'm not okay means that I'm having a mental disorder. So what defines mental disorder? Obviously kalau korang nak define satu demi satu mental disorder dalam DSM-5 tu, saya sendiri pun tak hafal yang beratus-ratus diagnosis yang ada tu kan. Obviously as far as I can remember, it's actually how I do it is actually based on the clusters of components of how we diagnose a mental disorder. So again, there are 4 components of diagnosing a mental disorder. So tadi mental health, what are the components of mental health? Second one is what are the components of us diagnosing a mental disorder? So what are the 4 components? The first components will be the clusters of symptoms and signs. Kan? None of the psychiatric diagnosis or psychiatric research is actually diagnosed based on only one symptom or one sign. At least we have 5 to 7 symptoms, a cluster of symptoms on signs before we diagnose someone who have mental disorder. For example, for today, to make things easy for all of you, if let's say we want to diagnose a patient with major depressive disorder, you need at least 1 plus 5 symptoms and signs before you can say that maybe that guy has a major depressive disorder. 1 plus 5 means a lot, guys. There are lots of symptoms that comes together in a cluster that can make someone having a disordered mind or disordered mental states. Okay, so secondly, the component of diagnosing a mental illness is actually the duration of the symptoms itself. If let's say kita rasa macam kita ada gangguan for a few days, we feel a bit down, feeling helpless, hopeless, feeling guilty, feeling agitated, irritable, poor sleep at night, for a few days, just 1 or 2 or 3 days, just because of something happens before that, that is not considered major depressive disorder yet, until if let's say the symptom persist for the next 2 weeks, kan, as simple as 2 weeks. So every single day, you have the same clusters of symptoms. Maybe one day macam lebih insomnia tetapi kurang energy, ataupun macam itulah. We will have this a combination of class of symptoms that is actually persist for the next 2 weeks. So that will be the second component of diagnosing a mental illness. The third component will be the functional level. Means that someone yang ada functioning level macam kita semua ni, doktor-doktor sekalian, there will be time in which we are not able to function as good as we are before. So kita ada baseline kita. Every single one of us, kita ada baseline in terms of functionality. Kan, of course kita ada SOP dan jabatan, kita ada workflow dan jabatan, kita ada tugasan dan sebagainya. Tetapi kita semua tahu dekat mana baseline kita. The time in which we notice that we are not able to at least get to the baseline level of functionality means that you are not okay anymore. With the clusters of symptoms, with the duration that you have, plus the dysfunctionality, means you are having possibly a mental disorder. Not yet. Kita tak boleh nak beza lagi sama ada is a functional psychiatric disorder or something that related to the medical condition. Okay. And the last component in terms of diagnosing a person with a mental disorder will be to rule out any medical condition that can cause the same symptoms. For example, paling popular lagi, paling mudah, depression can be induced by hypo or hyperthyroid. Kan? So when we have these classes of symptoms plus the duration plus the dysfunctionality, and then on top of that suddenly we check our thyroid function, tengok thyroid function kita hypo very bad, itu hyper very bad, plus the somatic symptoms of the hyper or hypothyroid, obviously your depression is not because you are having MDD, but your depression is due to the medical condition that you have. So in that situation, the treatment will be different. So mental health issues is one thing, mental health definition is one thing, mental health component is one thing, diagnosing a mental disorder is another thing altogether. So when we are talking about challenges in life, right, many people is talking about stress and burnout, which is actually quite common nowadays. Every single one of us is talking about stress and burnout. Not only doctors, every single one in the hospital, every single jabatan yang saya pergi for the past 1 year, 2 years, 3 years, for the past 2 years and 3 years ni guys, pandemic, zaman COVID pandemic ni, I have talked about burnout and stress tu saya rasa dah lebih daripada 50 kali dah kan. So people is asking me and asking everyone in the mental health fraternity to talk about stress and burnout kan. Mudahnya guys, kalau macam ni kita nak bezakan antara stress dan burnout ni senang je. Kalau stress is actually when you feel overwhelmed with what you are doing. Kan kita rasa terbeban, kita rasa banyak sangat kerja, kita rasa penat, kita rasa tak sempat. That is stress. So bila you berhadapan dengan keadaan itu, you boleh katakan diri you stress. Tapi dalam konteks burnout ni berbeza sama sekali, yang mana bila seseorang itu burnout, dia akan rasa macam mana? Dia rasa powerless. Dan dia rasa macam tak dihargai. Dan dia rasa macam apa saja kerja yang dia buat not as rewarding as before. Dia tak dapat keseronokan daripada kerja dia. Orang yang stress, dia akan jadi panicky, agitated, anxious. Orang yang burnout, dia akan jadi low, dia akan jadi less motivated dan dia akan jadi depressed. So that's the two different things altogether. Kalau you perasan bahawa you feel overwhelmed, most likely you are stressed. Kalau you rasa macam you feel macam lack of motivation, most likely you are being burnt out. Tapi baseline ialah kau orang memang motivated. Baseline ialah kau orang memang boleh buat kerja dengan baik. Bukan memang daripada awal kerja, day one kerja memang tak pernah motivated pun. That is not burnt out. That is not burnt out because when we are talking burnout, sebenarnya orang yang burnout ni biasanya orang yang sangat motivated, very hardworking, buat kerja macam-macam kan, dia sangat semangat, semua kerja dalam jabatan dia buat, dia rajin buat macam ni, dia buat ekstra dan sebagainya. Tapi malangnya dia tak boleh, one fine day dia rasa macam dia dah habis bateri. So bila dia habis bateri macam dia down, dia lemah dan sebagainya. Dan nowadays guys, ada satu lagi istilah yang kita kena aware of, which is actually the quitters. Quiet, Q-U-I-T-E, quitters. Quiet quitters. Who is this quiet quitters? Quiet quitters ni dulu-dulu orang cakap pasal work-life balance. So work-life balance means that we will do things at work as good as we can, and we will go back home and rest and have a life. Itu adalah orang sentiasa cakap pasal work-life balance. Tapi masalahnya guys, maybe you all dah kerja berapa tahun saya tak tahu. Macam saya dah kerja 18 tahun ni, I've never find that kind of balance in the real life kan. We can talk about it theoretically lah kan. We can talk about it theoretically, but for the past 18 years of working as a doctor, right, I've never find that kind of balance kan. And there will be always something that happens that tilts the balance altogether. Sometimes you need to focus on this, and you somehow you macam unfocus in this thing kan. Mungkin you tengah fokus dekat life, you punya kerja dari haru-biru sikit, and you focus dekat kerja and your life haru-biru sikit. That kind of thing will happen again and again. So if you are talking and fighting about balance, work-life balance, it's very, very difficult for us to achieve in a sense kan. Tapi at the same, as long as you can be dynamic and flexible in terms of work-life balance, I would say that you'll be okay. Because there will be lots of things that you can do for yourself actually to make you happy. Kan? Bukan kita nak harapkan orang happykan kita. Kalau kita nak harapkan bos happykan kita, kawan kita happykan kita, majikan happykan kita, organisasi happykan kita, saya boleh katakan bahawa kita penat je lah mengharap tu. Penat mengharap ni guys tak berguna pun, tak berbaloi. So we need to find happiness on our own, because that is actually very important. Because why? Because happiness for ourselves is actually good for our mental health, good for our physical health, and that's more important than any other things in the world. Okay, of course when we are happy, everyone surrounding us will be happy. Bukan sebab dia boleh bully kita, bukan, tapi lebih kepada the vibes, the positive vibes that can we bring out from the happiness that we have, right? So who is this quiet quitters? Quiet quitters is actually a very I would say that one of the most trending type kind of psychological well-being, in which quiet quitters ni guys adalah orang-orang yang dia kata dia nak bekerja dengan syarat everything must be work-life balance untuk dia. Tapi apa yang dia buat ialah dia akan cuba mencapai tahap work-life balance dia akan buat minimum dekat tempat kerja, dan yang lain-lain tu akan dilakukan oleh orang lain. Jadi hidup dia memang work-life balance lah, tetapi dia akan menyusahkan orang lain. Dan quiet quitters is actually the loudest in the department. So dia akan complain dan mula kita tengok macam kau lah yang paling tak buat kerja sekali, tapi kau lah paling kuat komplain kan. Memang akan ada kan kawan-kawan kita ataupun rakan sekerja kita yang macam ni kan, dia yang paling kuat komplain tapi dia yang paling tak buat kerja. Tapi dia lah yang paling kita panggil yang paling yang buat teruk sekali lah kan. Sampai kita kata aku tak ada masalah macam tu pun, tapi kenapa kau ada masalah? That kind of things, right? So this what we call as quiet quitters. Quiet quitters is not in Malaysia only. This is actually a worldwide phenomenon in which we will see a person that essentially keep on complaining about things, but they are not doing their thing. Okay, complaining about things, but they are not doing their things. So the one who should do their things tu, orang lain yang terpaksa menanggung beban dia. Sebab apa? Dia tak buat kerja. So dia akan complain. Seolah-olah dia lah yang paling buat kerja sekali dalam tempat tu kan, dalam jabatan korang ke, dan klinik korang ke, sebagainya. Kita rasa kerja dia kita yang buat kan, kerja kita lah yang buat kan. Sebab apa? Sebab dia duk complain, oh kita tak sepatutnya tu akibatkan orang lain yang kena bambu. Sebab apa kena bambu? Sebab ialah kerja tak siap kan. Dia akan saya tak nak buat kerja tu, saya bukan tugas saya itu bukan kan. Dan akhirnya orang lain yang suffer sebab because of this quiet quitters kita panggil. Dan obviously quiet quitters ni guys, sebenarnya kalau dalam konteks sistem kita lah kan, there is bukan no way lah kan. Sebenarnya dia quiet quitters ni dalam konteks environment kerja yang kita ada, kebanyakannya mereka ni seolah-olah orang yang paling banyak dapat reward. Satu, reward tak buat kerja. Dua, reward tak baik diberikan tanggungjawab. Tiga, reward boleh komplain suka hati. Empat, reward dia lah, dia boleh dapat gaji macam kita juga. Lima, kadang-kadang boleh dapat APC. Kan? So, the system does not protect someone that works hard. Kan? The system can protect someone yang macam ni. Kalau sebenarnya sistem boleh membantu kita untuk cut off these quiet quitters. Tapi kadang-kadang kita kesian dia, tak payahlah, janganlah bagi makan rendah sangat. Kan kesian kat dia. Tapi dia tak kerja setahun tak apa. Tak apalah, kesianlah kan, rezeki tu nak buat macam mana kan. Kalau kita tak bagi dia naik gaji nanti anak dia makan apa. Kan alasan dia kan. Tapi yang akan merana ialah orang-orang yang kerja kuat. So now I already talk about quiet quitters. I talk about stress and burnout. So how we want to help ourselves? Kan? So the second half ni, how we want to help ourselves? We have seen lots of problems in our life. Most of the time, guys, most of the times, when we are talking about system, our workplace, our environment in workplace and everything, it's not about the system altogether. Most of the problem that we have seen while we are working is not really to do with the system or the organization or the SOP, but it's actually because of the interpersonal. Majority of it is because of interpersonal. Someone can work, some of us work in very super busy super busy department, but they are happy. Some of us work in a super easy department. I don't know which one is super easy lah. Tapi cakap je lah kan. Super busy and super easy. Everyone say that their department is super busy, right? But there will be places in which people think, oh, super easy department pun tak happy. Why? Because it's not about the system. It's actually about the interpersonal issues that they have in the system or in the organization. Because system is flexible, organization is flexible, but people can be very, I would say, can be very stubborn, and they can be someone that menyusahkan kan, dan menyukarkan keadaan kan. So most of the time, the problem that we have in our working place is actually not about the system itself. Of course, system can be improved all the time. Organization structure can be improved all the time. The SOP can be improved. The work flow can be improved. But interpersonal issues is not something we can improve based on papers. So if you're seeing a lot of our colleagues yang jumpa kat kami, contoh macam psychiatry nowadays, sekurang-kurangnya Hospital Tanah Alustar, we allow doctors to walk in and get an appointment to the psychiatrist. Okay, we have a number of psychiatrists dekat Tanah Alustar. Kita ada giliran je. So kalau contohlah hari ni ialah Grand Dr. Rustam, walaupun dia tak on call, so Dr. Rustam kena bagi appointment kepada the doctor, the young doctor, houseman ke, medical officers ke, pakar yang datang untuk mendapatkan bantuan daripada kami. So they can walk in and get straight to the psychiatrist, and it can be done outside of the typical clinic punya time lah. Contoh kami punya klinik pagi, Ahad, Isnin, Selasa, we will do petang, that kind of things. So we will try to help them to get through their mental health issues or mental disorder. Okay, so dalam konteks itu kan, kebanyakan masa bila kita jumpa doktor-doktor yang bermasalah kan, majority of them is not about the work, because most of us, no, I'm not talking about quiet quitters. Quiet quitters will always complain about work, but most of us is not talking about work. They are talking about kawan ni, bos ni, MO ni, houseman ni kan. Dan if you are talking about bullies, right, in the workplace nowadays, I would say that majority of the bullies will be the senior houseman rather than the others lah. So this is something that I would say a problem, which is actually we are trying to nip since even when during my houseman's days. Even during our houseman's days, we are talking about people who actually curi tulang dan sebagainya, dan dia orang yang menyusahkan kita sebenarnya kan. MO dengan pakar akan marah lah sebab mana ni kan. Tapi yang kena bahan kita kat depan tu lah, sebab kita seorang je dekat situ. So kita yang kena bahan. Yang mengelat tu tak kena bahan pun. So dalam konteks ni kebanyakan masanya kan, isunya adalah berkaitan dengan interpersonal issues. Sama ada you dengan paramedics, ke you dengan doktor, you dengan pakar, ke you dengan konsultan, ke you dengan colleagues, ke you dengan juniors, always something to do with interpersonal. There are many of you, especially young doctors, right? When they come to see us, it's actually about their relationship issues outside of the hospital, dengan pasangan, kahwin dengan non-doctors dan sebagainya, ada problem, anak dan sebagainya. And then obviously bila masalah-masalah berlaku, they will always try to relate back to their work nature, which is actually work nature kita ni, kita dah tahu dah sebenarnya work nature kita macam mana kan. The reason why we become a doctor. There's no such thing of macam can I not working macam tu kan, because we are dealing with human being kan. There's no such thing macam saya tak tengok kes sebab saya tak suka nak tengok kes tu. Tak ada guys. Kalau casualty tu korang nak tengok kes, kena jumpa lah kan, what to do kan, you need to do it, you need to see it kan. We don't have any other option kan. Itu macam saya tak suka pesakit macam ni, saya suka pesakit lelaki je. Sorry, you duduk kat mana ni kan. So if let's say you can pilih, why not kan, tapi most of the time we cannot pilih because our patient is our patient. They have their own urgencies, everything, and we need to help them. So having said that guys, when you're talking about interpersonal issues, obviously it's very difficult because we can deal with things in our workplace, right? We can deal with our patient, we can deal with the system, everything, but dealing with interpersonal can be damaging and especially can be tiring. And most of the time when we are talking about the interpersonal issues, right, one of the things that most of us is having a problem especially in our inability to say no to something that we should not doing kan. Contoh macam katakanlah bos bagi 10 kerja sedangkan you boleh buat 5, tapi kena bos yang kata 10, you 10. Lepas tu yang kita juga yang ke laut dalam. Sebab apa? Kita tak mampu pun tapi kita tak cakap no. Sebab apa tak cakap no? Takut malu, takut nanti jatuhin muka sendiri, takut nanti bos marah, takut nanti bos rasa macam kita tak boleh dipercayai, takut kan. Sedangkan kalau contoh macam saya ni tahap ala-ala bos lah juga kan, tahap konsultan ni macam ala-ala bos juga. Bila kita minta tolong dengan junior-junior kita kan, sama ada saya punya trainee ke, sama ada saya punya medical officers ke, houseman, saya minta tolong tu bukanlah maksudnya arahan macam kau kena buat kan. Kalau kau tak boleh buat kan, beritahu kita, then we see how we can do it together ke, ataupun kita boleh minta orang lain tolong buat ke dan sebagainya kan. Of course none of us can do everything, right? None of us can do everything, but many of us try to do everything. That's the problem, right? That's the problem, and it causes pain to whom? It causes pain to ourselves. So our ability to say no is actually one of the most, I would say one of the most critical things need to be done and need to be practiced again and again. Okay, next one. Most of the things that happens in our life that causes stress, burnout, and everything is actually about what we call as external locus. External locus is actually about everything that happens surrounding us but affecting our psychological well-being and affecting our emotion and also our mood. So can you see how people can really ticks you off every single day kan? Contoh simple macam hari tu hari yang baik, contohlah hari ni kan, you bangun pagi dengan seronok, bangun awal, siap semua cantik, dapat sarapan, perut kenyang, rasa tenang, tengok pesakit 1, 2, 3, 4, 5 semua okey. Suddenly tengah hari tiba-tiba ada something happen which is nothing to do with you, tapi you punya mood rosak. That's what we call external locus. Maksudnya sesuatu daripada luar mengakibatkan kita punya locus control terganggu. Because locus control ni guys ialah satu konsep psikologi yang mana kita ada dua locus control. The first locus control is actually our internal locus control. Second locus control is actually external locus control. Many people is actually affected by the external locus control. People affected by others, people affected by situation, people affected by environment, and they don't have strong internal locus control. What is the internal locus control? Internal locus control is about our ability to cope, our ability to make a good decision making, our ability to plan, our resiliency, our passions, our strength, our weaknesses. That is actually the internal locus. Many of us always trying to what we call as pointing out external locus cause me pain, which is actually not really true. Okay, because in life guys, not everything that happens outside of our life can affect us. For example like this kan, ada orang akan cuba membuat kita marah lah kan, dia akan datang ke kita, senang cerita patient lah kan, patient tu tak pernah jumpa kita, tiba-tiba dia katakanlah dia tunggu lama kan, dia tunggu dah pukul 8, dia datang pukul 8. Ini biasa berlaku kan. Dia bukan datang pukul 8, dia datang pukul 7. Dia datang pukul 7, dia letak ke appointment dia pukul 11 kan. Datang pukul 7 appointment dia dengan harapan nak boleh tengok pukul 8. Kan dia letak appointment tu, lepas tu diproses appointment pukul 11, so pukul 11 saja kena tengok kan. Dan you bukanlah priority sebab we have given you time at 11 AM, bukannya pukul 7 pagi, tetapi they don't care, right? They don't care. So they wait by 9. And by 9, they just open your door and just shouted at you, which is actually not necessarily you who will be seeing the patient. Tapi because you are the nearest to the crowd, you will be the one yang akan kena dulu. Because why? Because you lah kat situ kan nak serang, takkan dia nak pilih dia main baling dadu pula, nak pilih bilik mana kan dia akan serang yang paling dekat lah kan. So suddenly you get shouted. So to get shouted by someone that you don't know is actually one of the craziest insult they can get lah in a working place kan. So kau tak kenal aku, kau tak tahu aku buat apa. Kau tak tahu aku tengok patient ni. Dan kau shout aku, kau jerit aku depan patient lain. Dan itu sangat memalukan kan. Itu satu bentuk penghinaan bagi kan. Kalau kita tak marah tu pelik lah kan? Kalau kita tak marah tu pelik. Tapi marah tu guys, it depends juga. Because why? Dalam konteks ini, kalau kita retaliate, what will happen? The one who will be suffering through that retaliation is not that patient, would be us. Because nanti kita akan cakap, oh, yelah, dah kan dia adalah someone yang akan rationalize the behavior, right? Yelah, dia datang pukul 7, mestilah dia tengok awal. Walaupun appointment jam 11, dia pergilah tengok awal sikit. Macam, why me? That kind of things, right? I'm not saying that any one of you dapat ni, tapi I think there are this kind of experience before in our working place, right? So, in that situation, guys, the reaction is the most important thing. How we want to handle our own emotion. Because people can trigger us and it can create emotion, certain emotion, which usually we will differentiate between negative emotions and positive emotions, which is not correct. Sebenarnya emotion is emotion. Kan, the one which is actually negative or positive is actually the behavior. So the reaction of the emotion will dictate whether the emotion is positive or negative. Okay, emotion is actually a neutral being. Kan, emotion especially motivates us to do something. The motivation to do something, the behavior, which is the product of the emotion, will dictate whether it's a positive or negative. For example, anger can create two different kind of behavior. One kind of behavior can be negative and negative repercussion. Secondly, it is positive. It can bring control. Okay. What kind of behavior kalau kita angry akan mengakibatkan kita dapat negative repercussion. Contoh macam he shout at you and you shouted back. Kan? You shouted back. Number satu, you actually bringing yourself down to that level. You shouted back to an angry person that's actually tidak apa kita panggil? Tidak yang dia marah kita secara tidak betul kan. So when someone shouted at you, the one is actually not civilized is that person. Tapi once you shouted back, you become the same level as that uncivilized manners, guys. And we don't want to do that because our professionalism is civilized. So how we want to avoid getting carried out by the emotion, what we call emotional regulation. So one of the things that we need to do day in, day out is actually how to regulate our mood, how to regulate our emotion, how to regulate our psyche to the extent of, to the point in which we will not be affected that much by any kind of provocation. And this is not easy. Kan, kalau korang sebenarnya something, we are trained every day pun. After many years of being a doctor, right, we will see lots of bad things happens in the hospital, in our clinics, everything. Technically, we are supposed to be the most passionate kind of doctors. Penuh dengan kesabaran, ketenangan, relax dan chill. Tetapi ramai kita makin sini makin jadi macam tebuan kan. Jadi macam lagi garang kan. Ataupun jadi monster, jadi zombie dan jadi dinosaur. Kenapa? Sebab we are not learning. Kan, we are not learning. So, one of the most important thing in terms of taking care of ourselves, how to regulate our emotion and use the emotion, because the emotion has their own energy. As I said, emotion can motivate. So how we want to use the same emotion to come out with a very good kind of hasil. Sebagai contoh, in that situation where you were being shouted, kan, how you want to be macam number satu, acknowledging and actually identifying with yourself. Number one, it's about, okay, someone is shouting to me, I feel embarrassed, number one, I feel insulted, number two, and because the embarrassment and insult that I feel, I get angry. Angry because of what? Because of the behavior. But now, when you are angry, when you are awareness, there is awareness of anger, you need to react to that anger. How to react to your own anger? You can shout, yes, but it will be bad for yourself and your own manners and also your stability. So how to use that anger energy to bring out a better options or better solution. So we can be very, very what we call as assertive. We can still stand up. We can tell the patient, minta maaf banyak-banyak, saya minta maaf sebab sakit ni menjerit, minta maaf banyak-banyak. Saya rasa sekejap, saya nasihatkan ni, kalau tak nanti benda ni mengganggu puan pula. So what am I doing there? I'm actually telling him off in a way. Bila saya cakap minta maaf banyak-banyak puan, minta maaf sakit ni mengganggu pula kan. Sekejap saya nasihatkan dia, nanti kalau kita tak boleh nak bersembang lagi, sekejap lagi saya sambung balik. So actually I'm actually telling him off in a way. Instead of I just shouted back to him, I actually doing something else in a different way, which is actually now he needs to realize or acknowledge there are other people inside the room, and all these people is very important to me, not you. But I will handle you because they are important. Okay, this is actually what we call as assertiveness. One steps of assertiveness. Number two, I will just say sekejap Encik menjerit dengan saya kenapa? And smile is one of the most powerful, I would say, weapons in a very strained situation. Sebab when you can smile during this kind of very high tension situation, actually you are winning. Bukanlah kita nak menang sangat, tapi we want to control the things. So smiling and then tell them off why you need to you shout, and then he will just blur. They will just blurt it out because why? They are angry. But with your composure, guys, you can stop them from just continuing that kind of uncivilized behavior and manners they are showing to you. So emotional regulation is something that we need to learn. And then how to do it? Because whenever you go through this kind of situation of difficult circumstances in your life, right? Try to check back on how to do things better. Reflection and what we call as muhasabah and checking back how to do it better will help you to handle that situation better in the long run. Ni tak payah nak buat root cause analysis ke, nak kena pergi meeting aduan, tak payah guys. You can do it on your own. You can do it on your own and you can reflect on your own self. Try to make things better and try to make things under your control rather than you are being controlled by the situation. Okay, some of us were facing a toxic environment in workplace kan. Kita pergi kerja tu tak seronok kan. Walaupun kita minat lah, contohlah saya psychiatrist kan. Saya suka saya psychiatrist tapi pergi satu jabatan ni. Jabatan psychiatri lah kan. Dekat mana-mana hospital je lah. Pergi tu rasa tak seronok. Macam ada je macam benda tak kena kan. Very bad vibes kan. Ada macam seolah-olah dinding berbicara guys. Botol air berbicara, telefon berbicara, dinding berbicara, semua berbicara kan. Kita rasa macam lemas, macam tak kena, macam tak best, macam sentiasa ada yang tak kena. What we call as a very toxic environment kan. And it happens in many places, right? And we know that it's happening in many places. In many places in any kind of departments kan. So toxic environment is something that can be demotivating for us, right? And usually the culture of the environment actually dictates by the boss. Okay, the boss maksudnya the boss tu ialah kita punya HOD dan juga orang-orang kanan dalam jabatan itu. They actually dictate the environment of the departments. So if let's say you go into a new department and you feel like something is not right with the department, and people always something is happening behind you after a meetings and everything, means that environment is very toxic. So how do we handle toxic environment? So first and foremost, when talking about toxic environment, right, it's not about you. Okay, it's not about us. So if you think you are not the reason why the environment become toxic, unless you are the one who makes the toxic environment, so tak maaf banyak-banyak lah, I also don't know how to help you. Because obviously you don't know that you are the one who makes that thing worse for everyone. Kan, cuma mungkin you tak sedar. Tapi generally what we can say is actually if you are into a toxic environment, first and foremost it's not about you. Number two is actually you stick with your responsibility. Number three is actually you make minimal contact with everyone and anyone you feel like they are toxic. Number four, make sure that the communication in that line, in that department, in that jabatan, always maintain professional Number 5 is actually avoid any kind of social discussion during work dekat this kind of environment. Sebab apa? Social discussion, sembang pasal anak, sembang pasal suami, sembang pasal isteri akan menjadi bahan untuk dijadikan benda yang lebih teruk lagi. Because dalam situasi di mana you duduk dalam environment yang toxic, you should not open up about your possible weaknesses. Faham tak? Okay, remain professional, make it simple, make it candid, make sure that every single work is actually about professionalism. At the same time, just maintain what you need to do. Make sure that you make sure that you do all your responsibilities well. Jangan kerana environment itu you tak buat kerja, malas dan sebagainya, because bila tak kerja, malas, tak tengok patient, tak settle kerja dan sebagainya, obviously the one who will be affected will be you again. So regardless of what environment that you are working on, it's very important for us to maintain our composure, to make sure that at the end, regardless of what kind of environment, we still benefit from it because we are maintaining our professionalism, our level of responsibility, and our work rate yang sama. Betul tak? So even in this kind of situation, you still can garner something for your own sake. Okay. Next one. If let's say you feel like macam, alamak doktor, I think I need to see psychiatrist lah. Ini tak tahan lagi lah. Kan? Oh, I think I need to call the SEHAT. Oh, I yang ke tolonglah cari aku psychiatrist orang sebab aku tak tahan dah. Always has somewhere that you can go. Kan? Of course, one of the most concerning things when you are seeing a psychiatrist ialah cerita you akan sampai ke semua orang. As if macam kami ada masa nak bercerita pasal korang dekat semua orang lah. Kan contoh ramai di kalangan pesakit-pesakit memang doktor dan sebagainya, you please sebelum apa-apa lagi dia dah bagi amaran kat saya. Doktor jangan buka macam-macam. Doktor jangan tulis semua benda dekat dalam file doktor. Nanti semua orang tahu nanti. Macam kan, tak apalah kan. Which is actually confidentiality. Kan, not like we want to tell every single thing to everyone, and we are not sharing everything too in our file. Kan, sebagai contoh macam there will be things yang kita akan silent. Kan, because why? Because that silent thing, even though we know that the system, most of the system, number satu, non-psychiatric doctor cannot, kebanyakan lah kalau ada you all ada system dekat hospital you, guna EHIS ke apa ke, you akan ada sistem di mana non-psychiatric doctor cannot access psychiatric patient punya file kan, unless it's actually consultation liaison punya patient ataupun patient yang kita tengok dekat kecemasan kan. Otherwise you cannot access anything about that patient. Contoh macam kalau doctors come to me, paramedics come to me, and I enter the general psychiatric note, no one can see unless you become the psychiatric doctor. Even that pun kita tahu baca apa yang baca sebagainya kan. So kalau tak ada orang baca tiba-tiba, so once you open that, you need to register yourself, that kind of thing. So everyone knows who's actually opening that. I've tried before with few of my doctors that seeing me. I asked them to try to access my file. They cannot, because why? The system is there. But yes, of course, there will be times in which adalah bocor di sana sini, which is actually beyond our control. But at the same time, kan, there will be the story that I put inside the notes is not about everything, because there's so many macam very intimate stories that should not be there in a sense, because the most important thing is actually how can I help them. But I need to know what all those stories, because what? Because that is actually part of my formulation of your problems. Okay, it's not about me wanting to macam mendengar cerita-cerita juicy whatever is, no, right? It's more of me trying to formulate your problem. So in that sense, it's not in the record, but actually I know what is actually happening to you, and it can help me in terms of formulating and also managing you better, because that would be the first option. If let's say you don't want to be in the system, right? You want to see someone else. Obviously, you have that options outside. Either you want to see a registered counselor. Many of us doesn't want to see registered counselors, but I would say that if you have something that you feel like ini tak payah makan ubat pun tak apa ni, yes, you can see the registered counselor. Number two, you can see a clinical psychologist, not any kind of psychologist, but a clinical psychologist. Why clinical psychologist? Clinical psychologists, they have the ability to do psychotherapy. Counselors don't have. Clinical psychologists, they have. So they have a skill of psychotherapy, which is actually we can do it. Not all the psychiatrists again, but generally every psychiatrist at least has one psychotherapy skill. So in that situation, you can see them outside. You can see them any day that you want to see them outside of the hospital, outside of the clinic, and you can do it on your own. Okay, and obviously nowadays we have options outside in the form of private psychiatrists, which is available all over Malaysia technically. Okay, that will be the way forward for all of you if let's say you need help. Because guys, why is it so important for us to get help? Because at the end of the day, this is about us. This is about you yourself. And it's about, if let's say I'm having problem with my mental health, it is about me. I want to have my own future. I want to have my own things in life. I want to do things. I want to do so many things, right? So I must make sure that my mental health is at the top, or at least always stable in a sense. Oh, yeah, of course, there will be times in which it's unstable, like the problem, the stress, the burnout, and whatever it is. But that is part of life, right? But at the end of the day, the reason why we need to get help because we want to take care of ourselves. And most of us, right? Not all of you, but most of us has someone that we love. Either it's actually our spouses or our girlfriend or boyfriend, or maybe our father, our parents, or maybe our children, our siblings. So we have someone that we love. So in terms of mental health, guys, it's actually not the same like physical illness. Mental health does not only affect that person. Mental health issues or mental illness can affect the whole family. Kan? Dia seumpama you ada seorang pesakit yang ada CDA, hemiplegia ke, and paraplegia ke dan sebagainya, and you need to take care of them 24 hours a day. Kan? Ataupun demented patient still partly psychiatric patient, right? So these are the situations that you have when you are dealing with mental disorder. It's actually debilitating, then it can be something that can be paralyzing, and it can affect the whole family altogether. So someone will be having problems even though one person in the family was diagnosed or is diagnosed with major depressive disorder, but every single one that lives together with him or her is actually suffering a certain level of mental health issues too. Because of this situation. Bukan maksudnya orang yang sakit itu toxic, tetapi because the effects of mental health these issues, guys, is not essentially only to that person. It will affect everyone. For example, couples, right? Couples will bring their spouse to the hospital with problems, kan? Mental health problems. They also suffering through a certain degree of mental health issues. And sometimes, not all the time, sometimes they also need treatment. So in this situation, guys, why is it important for us to take care of ourselves? It's actually for our own sake and the sake of everyone that we love. It's not about someone else. It's not about our boss, ke hospital, ke klinik, ke sebagainya. We do our best for ourselves. Once we become the best of ourselves, we can do every single thing the best that we can. And everyone can benefit from the best of us. That's the most important thing, right? So I would say that this is actually the gist of why this topic, are you okay, is very important in a sense, because taking care of ourselves is actually the first layers for us to be a better doctor, a doctor that we want to be. Because I would say that as every single one of you want to achieve something in your life, right? Want to be someone in your life, regardless whether you want to stay or not to stay or wherever you want to go, you want to achieve something. So for you to achieve something in your life, you need to be the best, right? You need to be the best for yourself, not necessarily be the best in the department, in the hospital or in clinic, right? Not necessarily, but we still want to be the best for our own sake. Okay, I would say that that's all from me. I give back to Dr. Faiza. Hopefully ada soalan kan, ada 6 minit lagi. Okay.
Okay, thank you Dr. Rostam ya. Saya nak bacakan satu soalan dari chat pin kita ya. Salam Dr. Rostam. One of the reasons why doctors often reluctant to seek for treatment for psychiatric illness is because of legal consequences regarding their fitness of practice. Can you comment about this? Maybe doktor boleh sentuh juga tentang client and psychiatrist punya privilege tu juga kan? Ada kan yang tu?
Ada. Okay, pertama sekali, usually kan bila masalah fitness of practice ni, sebenarnya fitness of practice ni problem dia bukan masalah you ada sakit atau tidak. Majority of the situation is when you are not functioning in your department. Itu yang akan datangkan masalah ini. Fitness practice, you kena dilaporkan kepada MMC dan sebagainya. Sebab tak semua doktor yang datang kepada kami sebenarnya datang voluntarily. Kalau dia datang voluntarily kan, most of the time, you punya masalah tu takkan keluar ke mana-mana. Tapi ramai di kalangan yang datang kepada kami dirujuk oleh ketua jabatan ataupun dirujuk oleh HR dan sebagainya. Bila korang dirujuk oleh HR dan ketua jabatan, obviously they already know. And sometimes you get MC dan request for MCs kan, because you must remember that MC from psychiatry sangat special dalam konteks Malaysia. Lagi special daripada mana-mana MC lain. MC daripada psychiatry wajib dilaporkan kepada pengarah dan wajib dilaporkan kepada MMC dalam konteks pada hari ini. Sebab apa? Satunya mungkin diakibatkan oleh masalah-masalah dulu lah. Orang tak pergi ke hospital. Kan orang hilang dan sebagainya, MIA lah, missing MIA lah, kebanyakan MIA. Lepas tu kata, oh saya ni ada sakit mental tiba-tiba. None actually they has not been seen by psychiatrist yet. Tapi they say that I'm too stressed so I cannot work. So people say, get MMC lah. Kan, that kind of thing. So you are just fighting. Kan? So that's the problem with the fitness of practice comes when you the departments or your HR or your hospital feels like you are not able to practice as good as you can or on par like others. I can tell you directly that there are so many doctors that actually under my follow-up, but all of the, kalau katakanlah ada 10 doctors yang under follow-up sekarang ni dengan saya, cuma satu je di bawah MC. Satu di bawah MC tu sebab apa? Dia ada MC yang panjang, dia tak boleh habiskan posting dia memang ada masalah yang sangat berat dan sebagainya. We need to do it because of why? Bila you dah ada MC dan sebagainya, obviously MC will come into the picture, will ask you to come forward for fitness practice lah, lepas tu buat assessment 6 monthly dan sebagainya. Itu akan berlaku bila sesuatu berlaku dalam konteks kerja korang. Sebab korang kena bezakan macam ni. Mental illness one thing, you punya work performance is another thing altogether. Of course, mental health issues or mental disorder can affect your mental illness, your work performance, but it's not necessarily happen like that. So macam saya katakan, saya ada 10 doktor yang bawa follow up saya, satu je yang bawa MMC, maksudnya 9 orang tu, tak ada orang pun tahu yang dia ada psychiatric follow up. Sebab apa dia tak ada orang tahu dia ada psychiatric follow up? Nombor satu, sebab dia functioning dekat level dia. Walaupun dia ada stress, dia ada masalah, kan lepas tu dia ambil cuti dan sebagainya, tapi dia okay lah function. Nombor dua ialah dia tidak menggunakan alasan sakit mental dia untuk menyatakan bahawa dia tak boleh function. Sebab dulu ini cerita dulu lah kan. Bukan dalam hospital sajalah, mana-mana sekalipun. Mereka menggunakan alasan bahawa saya sakit mental, sebab tu saya tak boleh kerja. Bayangkan, sebenarnya ni tak betul. Kan ramai menggunakan alasan ni, saya sakit mental doktor, saya depressed, sebab tu saya tak boleh kerja. Saya depressed, sebab tu saya tak tengok patient. Saya depressed. They are actually pointing towards that diagnosis caused me to not able to function or practice. So then, what other option that your HR atau your hospital atau MC ada? Bila you kata you tak boleh function sebab you depressed, atau you tak boleh function sebab you anxious, atau you tak function sebab you ada bipolar sebagainya. That is not the reason why you are not able to function. It's actually not because of that. Yes, it can cause problems to your functionality, but you can, some of us salah faham dalam konsep ini kan. Bila ini berlaku, obviously they will come into the picture. Lain pula dalam kes di mana orang-orang yang baru masuk dalam pekerjaan, contohnya baru dilantik dalam kerajaan, itu cerita lain. Biasanya contoh macam doktor-doktor yang baru diserap dalam government, diberi kontrak, before diberi kontrak dia buat declaration. Dia buat declaration yang bahawa dia sedang menjalani lawatan dengan pakar psikiatri. Dalam konteks itu, it's not about fit to practice. Dalam konteks itu, dia akan membuat macam MMC akan keluarkan satu surat untuk dia teruskan perawatan dia di bawah psikiatri. Nombor satu. Nombor dua, MMC akan minta laporan perubatan perkembangan penyakitnya setiap 6 bulan untuk make sure bahawa dia punya kerja tu tidak terganggu diakibatkan oleh masalah kesihatan mental dia, dan pada masa yang sama mereka nak memastikan bahawa mereka committed to dengan rawatan yang diberikan. So ini adalah konteks saya pula. Yang ni obviously memang MMC akan keluarkan surat terus. Okay, so fit to practice tu saya boleh katakan bahawa usually not because of penyakit itu, tetapi because of functionality. Okay, you know right, there's lots of doctors actually diagnosed to have bipolar but still working. Kan ramai je pakar berunding dan ada sakit mental pun tapi function je, tak ada masalah pun. Dia orang tak adalah kena, oh you kena fit to practice, you boleh function. Tak adalah. Kan? Unless lah you are macam, you are having relapse, you are not taking your medication, relapse dekat hospital, macam semua orang nampak what you are doing kan. Obviously, they don't have any other option, they will send you for fit to practice punya meeting lah, right?
Doktor, last question doktor. Macam mana doktor sendiri nak tolong doktor yang need help ni. Kan? Sebab kita takut lah isu stigma lah kan.
Okay.
Ngada-ngada lah kan.
Okay. Okey lah, macam ni lah. Yang pertama sekali kan, bila kawan-kawan kita sendiri berjumpa dengan kita dengan masalah ini kan, of course kita akan ada kita punya perception and judgement. That's normal. Dan kita manusia ni memang sentiasa ada perception kita, perspektif kita dan juga judgement kita sendiri. Bila kawan kata aku stres lah kerja kat sini, contohlah katakanlah kawan saya ni kerja kat ONG, saya kerja kat psychiatry. ONG tahulah kan sibuknya macam mana kan. So memang dia tidur, dia konsultan kat ONG tak tidur malam sebagainya, buat op sepanjang malam tadi. Lepas tu pagi tu dia tanya pasal saya, lepas tu saya kata, kau tahu tak, aku stres lah kerja kat psychiatry. Lepas tu dia kata, kau stres kerja psychiatry, kau buat apa? Okay. Contoh macam tu kan. Kita memang kasi ada judgement dan juga kita punya perspektif dan perception kita towards and someone else ataupun others problem. Like masalah orang lain memang kita ada pandangan kita sendiri. How we want to help is number one, keep your mouth shut. Bila kawan kita bercakap dengan kita, bila kawan kita menyampaikan apa-apa masalah sekalipun, walaupun kita dengar masalah tu, alahai masalah ni lemah sangat lah. Masalah ni simple sangat kan. Wait first and bertenang and relax and dengar. Most of the time, when you are able to listen, you will help that person. When you are able to listen, you will help that person. Even though you are not even a single word. Kan? Most of the time when my friends kan datang jumpa saya untuk consultation kan, there will be pakar dan konsultan yang datang kat kita, dekat kami yang can I see you for a while, and then sembang. Kita akan dengar because you must remember this. Most of the thing kan that happens in our life can be only settled by that person. Kan, it's not about mental disorder. Kalau katakan kawan kita datang, bila kita sebenarnya kau ni ada penyakit, kau ni ada kegolongan ni, kau kena dapat, then we will tell them you need to get a proper help. But if let's say you feel like dia ni okay je lagi ni, dia tak ada sampai mental disorder tapi dia tengah goyang, so just allow yourself to listen to them without judgment, even though you have your own judgment, and then let them just pour out whatever they feel like to pour out to you. Why? Because they trust you. So when a person trusts you, that's actually salah satu keistimewaan yang you jangan salah guna lah, I would say. Kan, be trustworthy. Kan, dengar dengan baik, relax, chill, because at the end of the day, that's not your problem. It's your friend's problem. Tapi bila you mendengar kawan ni punya masalah, dia akan membantu menenangkan dia. Kan, dia membantu macam, at least dia akan nampak perspektif lain. Contoh macam mana nak bantu doktor, macam mana saya nak advise dia. Sometimes kan, kita akan ada tendency untuk nak advise. My side is very simple. When I want to advise people, I will ask questions. Okay, for example, macam kita nampak, okay, aku ada masalah sini lah, aku rasa macam aku punya kerja tak habis-habis lah. Okay. My question will be, saya punya respon bukan kata, dan kau kurangkanlah kerja kau, I won't do that. My response will be, kerja tak habis, kau apa yang kau buat? It's soalan. Rather than kau kurangkan kerja, memanglah jawapan yang paling mudah, kau kurangkanlah kerja kau. Tetapi it does not help them. Why? Because we don't know what's actually the nature of their job, what are the things that they do, and what's actually their problem, right? So we ask, apa yang kau buat tu? Kan? Ya, 1, 2, 3, 4, 5, 6, 7, 8, 9. Kenapa kau nak kena buat? Soalan lagi. Oh, sebab ni. Okay. Benda yang kau boleh kurang ada ke? Ni. So soalan demi soalan lebih membantu seseorang yang mengalami masalah berbanding dengan advice. So very simple, very short kan? This is the way for us to help our friend kalau dia mereka memerlukan bantuan. Okay? Itu saja jawapan saya.
Okay, banyak yang dah terjawab dengan simple explanation tadi tu. Keep your mouth shut kan. So, banyak membantu kita sebenarnya. Okay, nampaknya sampai di sini saja sesi CME kita pada kali ini. Terima kasih diucapkan kepada Dr. Rostam dan juga kepada semua hadirin yang telah bersama-sama kita pada petang ini. Okay, terima kasih dan kita jumpa lagi.
Bye.